We obviously have a crisis in our health service. As the motion states, according to the INMO, there was over 12,600 people without beds in Irish hospitals in November. It was the worst November on record for hospital overcrowding, and there were only 2 days in November which had less than 500 people admitted to hospital without an inpatient bed. For the first time, we had a month with over 560 children admitted without a bed in our hospitals. In my constituency, Tala Hospital had 35 people on trolleys this morning. Recently, Drogheda Hospital had 11 ambulances with patients queued outside, not only because of a lack of beds, but because of a lack of trolleys. More than 27,000 people left the state's emergency departments before being treated during a 3-month period this year. At University Hospital Limerick, 72 doctors recently signed a letter warning of persistent overcrowding, unsafe working conditions, putting patients at risk. The letter highlighted several near misses at the hospital's acute medical unit, where doctors say patients almost died due to understaffing and a lack of medical cover. The letter says patients have had to wait for more than 10 hours for a bed in the unit without any medical attention, while other lost patients are sometimes missed and are left unseen by a doctor for a number of days. The doctors have made a protected disclosure detailing their grievances because previous warnings have not been acted on by the hospital and because of a climate of a fear of retribution. Such is the state of the country's emergency departments, such is the state of our hospitals. We know that waiting lists are a chronic problem. Recently, the Irish Hospital Consultants Association said that 1 in 12 children in the state are on some form of hospital waiting list due to growing hospital staff vacancies and worsening capacity deficits. That's 98,000 children on some form of NTPF waiting list, more than 1 in 4 waiting longer than a year for treatment or assessment in public hospitals. They also said 21 additional children have been added to waiting lists for scoliosis-related surgeries since the start of the year. In September, the Irish Hospital Consultants Association said waiting lists may increase by over 20,000 in 2022, instead of the target reduction of 132,000. While the IMO has warned that the winter plan has increasingly become a media exercise rather than a meaningful exercise intervention to alleviate the year-round pressures on our health service. To quote the president of the IMO, "It's now more about branding than a meaningful intervention to deal with the capacity issues, workforce crisis and patient waiting lists." The yawning gap between government rhetoric and the lived reality of all those people who experience the broken health service has never been wider. Added into that, then, is the housing crisis, which is also now having a major effect on the health service. The Dáil just voted confidence in the Minister for Housing. The consistently failed policies are going to continue, but the consequences are being seen in education, in healthcare. To quote the INMO, "The lack of suitable available accommodation and increasing rents is having a hugely negative impact on our ability to retain nurses and midwives, not just in Dublin, but in other cities and towns where there is significant pressure on the rental market. Affordable accommodation in close proximity to hospitals and other healthcare settings must be made available for nurses and midwives who work long hours and shift work. Many hospitals do have land that is suitable for the development of such accommodation. We also need to give serious consideration to accommodation allowances for nurses and midwives working in urban areas to compensate for the high cost of rent and housing in our cities and large towns. There's about 200 nurses and midwives who have remained absent on sick leave due to long COVID. It's shameful that the special leave with pay scheme was ended. The Minister must ensure that the incomes of the workers affected are protected. The fundamental cause of all of this is that we have a two-tiered and fragmented health service, a chronic lack of capacity in staffing at A&E, acute and elective hospital services, ICU, public health teams, primary care and GP services, mental health, disability services, you could go on and on. We have one of the lowest number of public hospital beds on a population basis and the fewest specialist doctors per capita, both around 40% less than the EU average. Dr. Brian Turner at Cork University Business School has said that the Irish Health Service is effectively having to ration care through long waiting lists and wait times for care as a result of serious capacity and resourcing deficits. Thousands of health services have still not received the COVID bonus. So we have a dramatic underfunding and underinvestment in our public health service. And yet this morning, the BlackRock Clinic Group reported that its income rose 21.5% in 2021. Their profits doubled. Just like the housing crisis, a wealthy minority is doing very well. We need to invest properly in our public health service, and we need to take the BlackRock Clinic and other private hospitals into public ownership and build a single-tier, public, national health service, free at the point of use, funded by progressive taxation.